Dr. Kate Leiritana.
Thank you, Dr. Sarmiento, for the introduction. I'd like to thank TVUP for providing me the stage today to share a topic that is not often discussed, but is, I think, equally important. I'd like to commend Dr. Bravo for giving us such a comprehensive picture of HIV. Now, I want to explore HIV in women. So isa po itong journey na pag-uusapan natin. We will backtrack a little bit on the history, because I believe that in order for us to be able to prevent catastrophe, we should learn from our past. So the objectives of my talk is to discuss the epidemiology, the factors that increase the risk of HIV in women, and the issues unique to women living with HIV. So magsimula naman tayo muna sa epidemiology. Gaano po ba karami ang mga kababaihan na may HIV sa buong mundo? So currently, there are 20.2 million girls and women living with HIV. And we can see here that the biggest proportion when we talk about geography, of course, is in Africa. In fact, Sub-Saharan Africa, which represents about 70% of the world's HIV population, 56% po ng mga people living with HIV doon, ages 15 to 24-year-old, are kababaihan. So sa kanila, mas marami pong babae ang may HIV kaysa lalaki. At alam po natin na ito ay taliwas sa ating sariling epidemiology na kung saan lalaki ang mas marami. So ito po ay dahil Africa has a generalized epidemic na kung saan sa general population po ang representative ng drivers of the epidemic, versus sa atin na isang concentrated epidemic na kung saan ang mga key affected population ang usually ang most at risk. Kamusta naman ang kababaihang may HIV sa region natin, no, sa Asia and the Pacific? So here we see that only 2.1 million as opposed to the total of 5.7. Dito na po natin makikita ang effect ng isang concentrated epidemic, dahil majority ng mga bansa sa Asia and the Pacific ay ganito po ang klase ng picture ng kanilang epidemiology. So dito po makikita natin na mas marami ang kalalakihang merong HIV. Makikita po natin throughout time naman na ang prevalence or ang women living currently with HIV, kahit kailan pa sila na-diagnose, is steadily, slightly increasing, pero parang nag-plateau na siya, okay, throughout the years. Kumpara sa rapid rise nito noong late 90s and early 2000. Kamusta naman ang new infections among women sa Asia Pacific after a steep incline? Again, in the late 90s, nag-decline na siya ngayon. So hopefully, this means, at least in Asia Pacific, that we are seeing less HIV new cases among women. Sa deaths po naman, good din po na makakita din tayo ng decline. So decreased deaths, but sustained prevalence means women living with HIV in the Asia Pacific are living longer, thanks to our modern medicine. Okay. Tignan naman natin sa Pilipinas. Napakita na to ni Doktora kanina. Gusto ko lang po i-emphasize ang females only comprise 6% of new HIV cases in the month of July. Yun po yung latest natin na HIV number. We can see here that males are still the predominant new cases sa atin. Often, females may represent yung tinatawag nating diagnosed at pregnancy. Now, sabi ko po sa inyo kanina, pag-uusapan natin a little bit about our history. So ito po ang latest data na cumulative number of cases sa Pilipinas. Makikita nyo po dito na nagsimulang magbilang ng HIV cases noong 1984. Pero nung time na to, medyo retroactive to kasi 86 na document, pero kumbaga nag-retroactive reporting na lang noong 1984. Noong unang panahon, up until 1991, majority po ng ating mga kaso ay kababaihan. 62% of the 213 were females. During the early years, often our cases were from people who had exposure abroad. Pero starting 1985, nagkaroon na po tayo ng steady increase of HIV cases from our female commercial sex workers who initially had clients from countries with high burden of HIV, pero sa kinalalaunan, nagkaroon din tayo ng ating local endemic transmission. Fast forward po tayo sa 2007. Dito po nagkaroon tayo ng tinatawag na sexual flip na kung saan naging majority na ng ating new cases ay mga kalalakihan. And currently, ngayon, 95% of our new cases have been males. Now, sa mga kababaihan natin, important na makita na 96% sa kanila were within reproductive ages of 15 to 49 years old nung sila ay na-diagnose. Ang implication po nito ay maaaring maapektuhan ang kanilang mga future na mga anak kung sila ay hindi ma-enroll into care. So gusto ko lang po i-emphasize that we have an opportunity to create an HIV-free generation as long as we practice prevention of mother-to-child transmission, lalo na kung nandun sa reproductive age ang ating mga newly diagnosed na kababaihan. So ito po ay konting history ng ating HIV. Alam nyo po ba na ang ating mga libreng antiretroviral therapy na na-enjoy ngayon ng ating mga kababayan ay dumating lamang noong bandang 2001, 2002. Okay? Noong early times, noong 1984 hanggang 1991, wala po tayong kagamutang available locally. So ang nangyari po ay ino-observe lang natin yung natural history of HIV. So isi-share ko po sa inyo ang isang study na ginawa noon na kung saan 53,000 female commercial sex workers from 2 areas in the Philippines ay nag-undergo ng multi-year seroprevalence survey. Ibig sabihin po nito, sila po ay sinubaybayan, no? Taon-taon mula 85 hanggang 92. Nagte-test po sila sa STI at HIV. Ang HIV test po ay annually. Sila po ay nakaregister sa local government unit at nagre-report sa kanilang social hygiene clinic para sa bi-weekly STI tests, which is very commendable, no? Ibig sabihin, hindi lamang na nasusubaybayan natin ang ating mga at-risk na female, na aalagaan pa natin sila, care of our social hygiene clinics. So during this period po ng pag-seroprevalence survey, nakakita na out of 53,000, 72 po ang naging HIV reactive. At lahat po ng ito ay nakuha from vaginal sex with heterosexual men. Maaring kanilang mga kliyente or kanilang mga sexual partners like karelasyon, asawa, partner, etc. Ang age range po nitong mga 72 na reactive ay from 16 to 32 years old. Yung interval po, mula nung nalaman nila na sila ay HIV positive hanggat sa kumonsulta sila sa doktor para magpatingin ay 4 months. So kung isipin mo, napakalaking delay, no, ng time na yon. Ano kaya ang mga factors about it? hindi po natin alam. Pero currently po kasi, we really encourage na kung pwedeng on the same day na malaman mo na ikaw ay HIV positive, tayo po ay magpa-link to care para agad-agad tayo mabigyan ng gamot. So ito, medyo malas nga lang nung panahon nila, wala pang gamot. So siguro wala sila masyadong positive health-seeking behavior para magpatingin ng mas maaga. Nang kinompute ang duration ng pagiging positive nila bago magpa-test, so from exposure to possible HIV to the test na mag-reveal na positive is about 6.7 months. So you can imagine during this duration of having an unknown HIV status, if unprotected po ang ating mga encounters, maaari nating mag-transmit ng HIV sa iba pa nating kliyente nung time na yon. Ang kanilang baseline CD4 was high at 783. Ito po yung measurement ng health ng kanilang immune system. Maganda po itong score na to na 783, mataas. Ito ay equivalent sa isang HIV negative na person. So, bakit naging mataas ang kanilang CD4? It's because they test annually and therefore, kahit may 4 months or 6 months na lag, early diagnosis po yan. And hopefully, we can learn from that, no? Kung maging practice natin, not only among females but everybody else, na magkaroon ng yearly or regular, even every quarter if you are very active, na HIV test, mas maaga mo malalaman ang status mo, mas may magagawa ka, mataas pa ang level ng iyong immune system. Hindi ka pa makakaramdang ng mga complications ng HIV before you even get linked to care. So, among those na naging reactive, more than half, okay, progressed to an advanced stage of HIV or what we know as AIDS after 10.6 months. I saw kanina sa chatroom na may nagtanong, no, how long do you develop no opportunistic infections if you remain untreated? So remember, these women were untreated. So sa kanila, 10.6 months. But we must remember that this depends on what kind of strain or CRF or recombinant factor that you have. Kasi meron tayong mga fast-moving na HIV na kung saan itong progression from HIV to AIDS ay umiikli, no? In as much as 3 to 3.5 years. So, we must remember, sorry hindi po ito months, years po pala yan. Pasensya na, ang bilis naman nun. So, dati, di ba, parang 10 years pa bago magkaroon ng AIDS. Pero ngayon, due to some certain strains, pwede siyang umikli. And we have diagnosed this or have seen this in the Philippines. No? Ang interval naman from diagnosis to death ay among those who were AIDS, who had AIDS already, was about 15.9 months. Among the 13 na nakitang merong AIDS. So ang kalungkutan nito ay wala tayong nagawa nung time na yon, but to document what happened to them, we must be thankful for the availability of medications currently and the fact that they are free. So sana ay mag-take advantage tayo sa fact na yon and i-maximize natin. Okay. So now I want to talk about currently ang female representation in groups. Itong mga groups na to ay maaaring key population groups or groups lang in general. No? So una is among those who engage in transactional sex from the period of 2012, so later na siya to 2021, 3% ang female. So again, this demonstrates the flip that happened post 2007. Among OFWs, 12% ang babae. na mayroong HIV, and sa youth from 15 to 24 years old, 4%. Among those who inject drugs or PWIDs, 6%. So in general, hindi masyadong marami ang female representation among our key affected population. On a side note, among our pregnant naman, no? Among our pregnant, sabi nga kanina, 8 pregnant women were diagnosed with HIV in the month of July with a median age of 26. Mula nung 2011 hanggang currently, we had a total of 681 women diagnosed with HIV while pregnant. So malaki-laki rin, no, ang ating mga opportunities to prevent mother-to-child transmission. So I hope that it resonates with the healthcare providers we have here today who are taking care of pregnant women to please recommend an HIV test when you see them for the first time. It's an opt-out thing, but we can always nudge them in the right direction upang sila ay makapag-intervene tayo ng mas maaga. And from January 1984 to December 2021, 246 infants were diagnosed. Ito yung mga missed opportunities natin to prevent mother-to-child transmission because they already were HIV positive. So, ang tanong, given yung mga numbers na yon and yung mga kumbaga maliit na representation ng mga kababaihan sa ating mga key affected population, are women in the Philippines less at risk for HIV? So ayon sa isang pag-aaral ng DOH, no, nag-interview sila ng mga kababaihang living with HIV noong 2020. The risk of Filipino women for HIV is an interplay of factors which include sexual behavior ng kanilang partner, and the lack of knowledge on HIV prior to diagnosis. Ito yung naging disposition ng survey na yon. Una, regarding partner sexual behavior, may mga kababaihang alam na ang kanilang mga partners ay nakikipagtalik din sa iba, mapababae, mapalalaki. So aware sila sa high risk of acquiring HIV ng kanilang partner at merong ibang not aware. But among these two groups, they found out that HIV awareness was inadequate prior to their diagnosis, and their prevention and knowledge skills were inadequate at the time of interview. So these were 47 women living with HIV from 2016 to 2018 na kanilang in-interview. Nag-KII po sila nito. So we want to ask, bakit ganon? Bakit ganon yung picture na parang may lack or inadequacy of awareness and practice of protection? In a nutshell, ang mentality ay no risk, no test. Remember po, ang kababaihan sa Pilipinas is not in itself a key affected population. Ang key affected population po na siyang tinuturing na drivers ng isang concentrated epidemic ay sa Pilipinas, MSM, so gay and bisexual men who have sex with men, transgender women, people who inject drugs, and people who work in sex work. So yan po yung mga cap natin. So yung mga females who don't fall under those categories don't really find themselves at risk or admit to themselves that they are at risk. And therefore, they're also not direct targets of prevention strategies kasi kumbaga nagfo-focus tayo dun sa key affected population natin kasi sila yung, kung maka-impact tayo dun, buong Pilipinas, maaari bumaba ang population. So kung wala masyadong prevention messages for females, less ang awareness and therefore less inclined to undergo testing. lalo na sa subset ng mga hindi alam ang sexual habits ng kanilang partner or ang HIV status ng kanilang partner. So ang nangyayari po is ang desisyon nila na magpa-HIV test ay magiging based ngayon sa partner's health status. Kung ang kanilang partner ay umabot sa puntong nag-opportunistic infection na po dahil sa advanced HIV, that will serve as a trigger for them to also, because they are our sexual partner, magpapatest na ako kasi meron siya eh. Diba? So sometimes, females will present late in HIV. Makikita mong may advanced HIV na rin siya, mababa na rin ang kanyang CD4 count, baka may OI na rin siya. Okay. Pangalawa, makikita natin na ang mga kababaihan have difficulty coming to terms with HIV dahil sa maaaring implikasyon ng diagnosis sa kanilang pamilya. Therefore, they would be secluded and self-stigmatized. Okay? So, hindi na sila mag-access ng service. Pangatlo, women had lower treatment initiation and retention rates compared to the males. So what are the reasons for this? Again, multifactorial. Sabi nga nila, ang mga kababaihan compared to males have multiple burdens, no, when it comes to HIV status. Pero sa mga kababaihang natuloy din, no, sa pag-seek ng care sa kanilang HIV, they were motivated by the responsibility they felt to survive and live longer for their families. So sa mga na-interview ng mga sa KII na ito, hindi lang sarili ang iniisip ng kababaihan upang mag-decide na mag-undergo ng treatment, pero ang kanilang pamilya as well. Now, let's talk about the status of HIV knowledge among Filipino women in general po ha. Hindi lang po ito sa HIV sa women living with HIV, no. Ito'y mula sa National Demographic and Health Survey noong 2017. 94% have heard of HIV. Narinig. So, it doesn't equate to correct information or helpful information, but at least narinig nila. Hindi alien ang word na HIV. But only 1 out of 4 will have comprehensive knowledge about it. Saan ito galing? Anong ginagawa nito? Anong pwede mong magawa about it? 43% know na pwede mong ma-prevent ang mother-to-child transmission, no? Either sa pag-inom ng gamot or other things. So, ibig sabihin, more than half believe if the mother is pregnant, automatic the baby is pregnant. And if you have that mentality, baka hindi ka na mag-invest, in interventions. So we have to change that. And the sad thing is that 71% of Filipino women during this survey harbor stigma towards people living with HIV. Ang question yata dito is, kapag ang nagbebenta ng gulay ay may HIV, bibili ka ba sa kanya? And kapag ang batang may HIV ba ay dapat na mag-aral sa isang eskwelahan kasama ng mga ibang bata? So depende sa sagot sa dalawang tanong na yon, ina-assess kung merong stigma towards HIV ang kababaihan. Napansin na ang factors that increase stigma is lower economic status in life. So kung mas nakakaangat ka sa buhay, mas kaunti ang stigma mo towards HIV. And I don't know, but maybe that means a higher level of education and awareness. Ito namang sa map na to, here we can see yung percentage of women who know that HIV can be prevented by using condom via geographical status. So, alam ito ng mas maraming tao from CAR, no? CAR ang highest score, followed by Region 12 and Region 8. O NCR ay ano nga 68% lang. Okay, what about practice naman, di ba? So knowledge yung kanina, ang practice naman. Among Filipino women, only 0.4% had multiple partners in 1 year. 9% reported that they used a condom in their last sexual encounter. 4% reported ever having an HIV test and knowing the results, and almost half knows where to test. For the practices, it's quite dismal with regards to condom use and testing behavior. No, definitely much effort needs to be done, no, about this. So we need to increase the awareness and also access to condom. Okay. Ito po naman ang percentage of women who knows where to get an HIV test. Okay, so mga matataas ang score, region 6. Okay, 6, Mimaropa, 12, and NCR. I guess it helps if you have a lot of HIV testing places near your region. No? So, okay. Now, I want to spotlight on a certain key affected population na kung saan women are well represented. No? And these are female sex workers. This picture is what we call the condom lag. Okay? Na makikita natin na among sex workers, they report that their first vaginal sex with a male occurs at 18 years old. However, if you look here, their first condom use occurs 2 years after. So there's a gap of 2 years of unprotected sex wherein interventions may be done, but transmission probably went on. This is the same thing seen among males, especially MSM and transgender, but kumbaga, you move that further to the left kasi they start earlier, no, at 16. But still, it's a 2-year gap between initiation of sex, kumbaga, 2 years mula nung pumasok ka sa gera versus na-realize mo wala ka palang sandata, no? Doon ka palang naggumuha ng shield and barrel para lumaban sa gera. So, what we want to see is opposite. Kailangan ready yung ating mga at-risk na population before they even go to war. So this can be done if we provide awareness, education, and this is a call to action to our education department to please do include, no, STD and HIV informal education in our younger children para it can translate into action when they are sexually active. Going back, no, female sex workers in the past 30 days, 81% of them had a new client, 75 had sex with returning clients. They also have sex with their partners, be them boyfriends or husbands, and they have an average of 7 clients per month. 4.2% of the respondents reported engaging in chemsex or the use of drugs to facilitate pleasure during sex. 18.6% were forced into having sex. So there's an element of no consent here. Assault or rape. 1% engaged in anal sex and 16.6% engaged in group sex. Ang kagandahan na nakita ko, and I don't know if this is because of the good practice from the 1980s to 1990s, mas mataas ang condom use ng female sex workers versus all the other key affected populations across the board. Okay? We would like it to be 100%, of course, pero this is actually much better than the rest. And kudos, no, to the program which instilled this, and I hope this can be sustained and practiced pa rin. And these are the other statistics that are important. And if you see here, they are recipients, no, of information on HIV, and they do use forms of family planning, super high rates of ever getting tested for HIV, and better rates compared to kanina of tested in the past 12 months. So again, subset po ito ng kababaihan, female sex workers. Na himalayo po ito sa kaninang pinakita ko na kababaihan in general, no? So mas maganda yung ginagawa na ating mga sex workers with regards to prevention practices. All right. Pasadahan ko lang po ang mga concerns, medical concerns unique to women living with HIV, gynecological health issues, especially sexually transmitted infections, increased risk of cervical cancer. Cervical cancer, especially the invasive type, is an AIDS-related cancer. Increased risk of comorbidities. Kumpara sa babaeng walang HIV, mas mataas ang prevalence of comorbidities among women living with HIV. Women versus men in general, mas mataas ng konti. Having more than 2 comorbidities, mas mataas din. And polypharmacy, which follows because that means you take more medications. HIV medicine side effects and drug interactions are a concern, and aging-related issues including menopause. Ano po ang implikasyon nito sa mga healthcare providers ng mga kababaihang may HIV? Kailangan po aware tayo about the influence of HIV and the gender or sex on comorbidities. Kailangan po natin ng more targeted screenings, and kailangan ang healthcare natin is holistic and hindi po focus lang sa HIV and that's it. We have to look at the whole person. Isang magandang progress ay ang pagkakaroon natin ng U equals U. Isa po itong campaign na kung saan ang paggamot ng isang taong may HIV ay siyang prevention na po for transmission. Kung ang PLHIV ay nagiinom ng gamot at nakitang suppress ang kanyang viral load, hindi na po siya makapanghawa through sex sa kanilang partner kahit na wala pa itong condom. The risk of transmission is 0. It's important to explain this to your patient. Not only will it improve adherence, but it also relieves them from the guilt of being the source of HIV for all their partners. Okay. Another issue that is kind of unique, no, to women living with HIV are mental health concerns. And in a survey done among 150 women living with HIV, 97% of whom got HIV through sex, 3 from injecting drugs. Ito po yung prevalence ng mental health concerns. 1 out of 4 had depression, 23% had anxiety, and in the last 12 months, 28% had suicidal ideations. Moderate levels on all types of HIV-related stigma were seen in all, and ito po yung mga domains ng mga yon. This means mental health should be integrated even in primary HIV care. So kung hindi pa po natin ito ginagawa or nire-refer natin sa iba, at least mas-screen man lang po natin ang ating mga pasyente. I mean, not only among women, but all PLHIV, you should have integrated mental health services. Okay? At sa mga women living with HIV, ano po yung mga naging coping styles nila sa mga stress nila sa buhay? Nalaman na mas marami ang emotion-focused coping style using acceptance, social support, humor, positive reframing, and spirituality versus the other coping styles which are problem-focused and avoidant. Okay? Sabi daw nila, taliwas po ito sa international data na kung saan mas nakikitang problem-focused ang mga kababaihan in coping with HIV. So ano kayang meron ang Pilipinas? Bakit emotion-focused yung ating mga survey respondents? Ang naging social support ng ating women living with HIV, nakitang mataas. Okay. From moderate to high social support ang mga na-interview sa pag-aaral na ito. At ang source ng kanilang social support, significant others or partner in life, family, and friends. So ano pa ibig sabihin nito? Marami sa kanila ang nag-disclose ng kanilang status sa kanilang family, friends, and significant others at nakatanggap ng social support na siyang naging way for them to cope. Okay? Kahit na nakaramdam sila ng anxiety, depression, and suicidal ideation. Ito po ay, I think, aking second to the last slide na kung saan importanteng makita ang complicated intersection ng framework ng how HIV affects women living with HIVs and their family para maintindihan natin ang kakaibang burden na bitbit ng kababaihan. Meron tayong psychological impact, physical health impact, intimate partner violence, social impact na kung saan kasama ang stigma and discrimination, family separation, divorce, child-parent conflict, and impact on children's social life and education. And last, economic impact on women living with HIV and families. Ito po ang binibitbit sa shoulders ng ating mga kababaihan when they find out that they have HIV, and that's why their actions are dictated by the implications on all these. So ang way forward po natin, no? Puro problema yung binanggit ko, sana po ito yung way forward natin. On the left side, we have what we call the cascade of care. Two ways po ito. Una, ang HIV treatment side para sa mga diagnosed with HIV at ang HIV prevention side sa mga nag-test na negative. Meron po tayong pwedeng gawin sa bawat step. Ideally, hindi masyadong malaki yung gaps in between para hindi masyadong maraming nawawala sa ating health system, no? So ito po yung mga efforts, and hopefully we can find interventions at each cascade to retain our clients or patients in care nang mapangalagaan natin sila. Ano po ang mga ways na to? Ito po lang ay aking personal recommendations. Una, i-increase po natin ang access ng ating kababaihan sa education, combination prevention strategies, prevention of mother-to-child transmission services, and to treatment. Okay? Access. Pangalawa, when in care, magbigay po tayo ng high quality of care na holistic, na titignan ang buong katauhan ng ating mga pasyente. At pangatlo, dahil nakita natin na importante ang support system for coping sa mga kababaihan, we should provide adequate support systems and consider yung role ng ating kababaihan sa pamilya sa mga recommendations natin. Dahil kapag kababaihan ang ating pinag-uusapan, hindi lang siya ang involved, but the whole family niya, lalo na kung sila ay mga ilaw ng tahanan. So ako'y magpapasalamat po sa inyo for this time. I'd like to thank the women who have paved the way until now. Ito po nasa picture ay si Sarah Jane Salazar. Siya po ay namatay noong 2000 sa panahong wala pa tayong gamot sa Pilipinas. Ngunit kita natin dito na siya ay humarap sa publiko, nagbigay ng kaalaman tungkol sa HIV at ginamit niya ang kanyang sarili upang mag-spread ng awareness. So kung hindi dahil sa mga kababaihang tulad niya ay baka hindi tayo makarating sa ating kinaroroonan ngayon. So, and there are a lot of unsung heroes who will remain nameless, and we would like to thank them. So again, salamat po ng marami.